WKBN's Breast Cancer Awareness is sponsored by Boardman Medical Supply's Pink Promises Post-Mastectomy Boutique.
These days, we can Google the answer to just about everything, but using the internet to research medical issues can lead to even more questions depending on the source of information. So tonight, we sit down with an expert to debunk some myths surrounding breast cancer.
Myth. Annual mammograms expose you to so much radiation, they increase your risk of cancer. Dr. Nancy Gant is a surgeon and co-medical director at the Joni Abdu Comprehensive Breast Care Center. She says exposure to any radiation is linked to an increased cancer rate. But
a transcontinental airplane flight exposes you to more radiation than you would get with many, many mammograms.
Myth. After heart disease, breast cancer is the nation's leading killer of women. This one is confusing. Cancer is the second leading cause of death among women. Of all cancers, lung is the most fatal, followed by breast.
Pulmonary disease, lung disease, heart disease, stroke, the cardiovascular diseases, especially those that are aggravated by smoking, really have a higher mortality for our American women.
Myth. Removing the entire breast gives you a better chance of surviving cancer than having a lumpectomy with radiation therapy.
It's not the tumor in the breast which kills patients. It's the tumor that's sneaked out and has gone to lung, liver, bone, brain, or somewhere else.
That's why Dr. Gant says one size fits all doesn't work with breast cancer therapy. Instead, think of it like getting a designer dress for the Oscars made just for you. The goal is to minimize surgery and treat each patient individually.
The treatment of the whole patient is the life-saving maneuver. So when we're talking about breast surgery, we're talking about local control.
Myth. Overweight women have the same breast cancer risk as other women. Unfortunately, both men and women above their ideal body weight have an increased incidence of multiple cancers.
More aggressive prostate cancer in men and a higher risk of breast cancer, particularly in our postmenopausal patients.
Dr. Gant says fat is active living stuff that can cause big problems.
It is trouble. We really emphasize to our patients that they should be healthy and fit. We're not talking about a dress size.
Now, if you'd like to learn more from Dr. Gant, we've posted her full responses to each myth online as a web-exclusive video. Just go to WKBN.com and click on Breast Cancer Awareness under the Community tab.